Baystate Health has announced they will cut dozens of positions this week as part of their overall plan to keep the largest healthcare system in our area independent and financially strong. 22 News reporter Christina Demores joins us live in studio with what we know about these recent cuts.
Nick, this transformation plan has been rolling out since last fall. The CEO telling us these cuts are a difficult decision to make.
Another round of job cuts are coming to Baystate Health starting later this week. It's part of the healthcare system's 7% workforce reduction that began last year. So far, 60% of the total staffing cuts have happened through attrition, vacancies caused by resignations and retirements. However, this time around, 43 employees will lose their jobs. Baystate Health says that these positions were selected to minimize the impact on direct patient care. Despite the cuts, Baystate Health says they have been making progress, reporting 4 consecutive months of positive cash flow, receiving an A+ credit rating from the Fitch rating agency, recruiting, hiring, and retaining physicians, advanced practice providers, and bedside caregivers, and planning a $1.2 billion investment over the next 6 years. CEO Peter Benko calls these cuts a difficult step, but says they remain committed to staying independent and growing, saying in a statement to 22 News in part that they deeply understand the effect these transitions have on their workers. He later goes on to say that they are encouraged and extremely optimistic by their planning towards a clear direction forward. The affected employees will be notified of the cuts no later than this Friday, May 2nd. They will receive severance and career support if not placed elsewhere in the system. And starting this summer, the organization will begin their Baystate Health 2030 initiative to grow their hospital system and service lines. Working for you tonight, Christina Demores, 22 News.